Okay, it looks like everyone's here, so we'll go on and get started. I want to thank everyone for joining us today. I would like to welcome everyone to our Road to HIPAA Compliance webinar series. Today we are going to be talking about understanding the security rule. So just a few housekeeping items before we dive into the discussion. This session is being recorded, and all attendees will be receiving a link to the recording as well as a copy of the slide deck following the presentation. And also, I will be working on sending out the CCB Continuing Education Credit Certificates by the end of this week. All attendees will be muted throughout the session, but we encourage you to ask any questions using the Q&A feature located on the WebEx toolbar. I will be monitoring those throughout the presentation, and we will be reserving time to answer those at the end. Just a little background about Kirkpatrick Price, if this is your first time joining one of our webinars. We are a licensed CPA firm specializing in information security and regulatory compliance audits, providing assurance services to over 400 clients in more than 46 states, Canada, Asia, and Europe. The firm has over 10 years of experience in compliance frameworks such as HIPAA and HIPAA, ISO 27001 and 27799, and NIST. We offer both regulatory compliance and information security services. We provide consulting services such as policy and procedure drafting, risk assessment, internal audit plan and development, and readiness audits. And we also provide guidance and audit services on frameworks such as HIPAA, SSA 16, SOC 2, PCI DSS, FISMA, and ISO 27001, 27002. I wanted to take a quick moment before I hand it over to Mark to invite you to connect with us. You can subscribe to our blog for regular industry updates, tips, and best practices. And we also keep a library of our recorded webinars, which is located on our website. And also, LinkedIn is a great way to stay in touch with us and another way to stay in the loop with what's going on in your industry. So at this time, I'd like to welcome our speaker today, Mark Heimley. Mark is a regulatory compliance specialist with Kirkpatrick Price and a member of the Florida Bar with 9 years of experience in healthcare law, regulatory affairs, and internal compliance in the public and private sectors. His specific experience includes serving in the General Counsel's Office for a state healthcare oversight agency, regulatory affairs for a Medicare, Medicaid, HMO, and complex healthcare litigation. He is also STAN certified in the law of data security and investigations. Welcome, Mark.
Thank you very much, Sarah, and welcome to all of our participants, whether it's good afternoon if you're, depending on what time zone you're in, or even good morning. As Sarah mentioned, this is part of our HIPAA Road to Compliance webinar series, and we've done, I believe, 4 so far, and we'll be continuing through 1 a month through the rest of the year, and we'll have a little bit more information about our webinar series, what's coming up next month, and then what's coming up throughout the rest of the year. As we begin, I want to provide a legal disclaimer. This presentation is provided by Kirkpatrick Price for educational and informational purposes only and does not constitute legal advice. No attorney-client relationship is established by viewing this presentation, and should you need legal advice, we request that you please consult with your own attorney. Now that we've got the fun part out of the way, I want to give you an agenda, an overview of where we're going this morning or this afternoon in terms of understanding the security rule. I want to give you an overview of the rule because I think it's important to understand the context in which the individual parts of the rule fit, because I think that provides us the best opportunity to be compliant. And then we're going to talk about the 3 primary sections of the security rule: the administrative, technical, and physical safeguards. So let's start with an overview of the security rule. So the security rule is the best rule, and the way that I know that the security rule is the best rule is that in a poll with my 3 elementary school age children, they all voted the security rule as the most likely to succeed among all the HIPAA rules. Moreover, the security rule won a participation award in the 40-yard dash, loves sheep shearing, and is a prodigy at the hammer dulcimer. And I don't know how you can get a better resume than those items. But the security rule is the rule that probably most people think of when they think of HIPAA compliance. And so as we engage in understanding the security rule, the thing we should start out with first is to understand the scope of the security rule. The HIPAA security rule applies to electronic protected health information. So paper PHI is not subject to this rule. So when you're considering the issues related to security rule compliance, when you're considering controls, training, policies, and procedures. The goal is to design security for electronic PHI. So the way that we design our controls, the way we conduct training, the way that we audit, the way that we monitor, the way that we respond to incidents is going to be designed around electronic PHI. So in addition to thinking about the security rule within the perspective of electronic PHI, I want to also provide you with 4 overarching principles that are objectives for the HIPAA security rule. The first is to ensure the confidentiality, integrity, and availability of electronic protected health information. The second is to protect against reasonably anticipated threats or hazards to the security of electronic protected health information. The third is to protect against any reasonably anticipated uses or disclosures that are not permitted or required by the privacy rule. And then the fourth is to ensure compliance with the security rule policies and procedures of an entity by its workforce. And when we say workforce, that means everyone under the control of an entity. That potentially includes contractors and other individuals, even if those individuals aren't paid by an entity. So here, these are the four goals, the 4 objectives of the security rule with respect to electronic protected health information. And in addition to understanding that the security rule is about ePHI, it's also important to understand the goals of the rule when we're designing compliance controls and compliance programs. So we have the scope, we have these 4 overarching principles, and then we've got a couple of other, or one other main concept to consider, and that is a flexibility of approach. And there are 2 parts of that. There are entity-specific considerations, and then there are required and addressable implementation specifications. So when you're looking at the security rule, let's actually start with the second of those 2 items, the required versus addressable first. There are, underneath the administrative, technical, and physical safeguards, there are required standards, there are required implementation specifications, and addressable implementation specifications under each. And you can see this is a handy appendix that is in the text of the combined rule if you're looking for it. And this is just a cutoff of the top where you can see a part of the administrative safeguards section with the standards on the left and then the specific implementation specifications on the right. And if they have an R in parentheses, it means it's required. And if it has an A in parentheses, it means it's addressable. And so what the security rule says there are some implementation specifications that you have to comply with, and there's no alternative method. But then there are some addressable implementation specifications that allow an entity to choose an alternative equivalent compensating control. And so, for example, within the first implementation specification under the administrative safeguards is a risk analysis. That is required by the security rule. An entity cannot look at the risk analysis requirement and say, we don't believe that that's reasonable for our organization. We're going to try and choose an alternative equivalent compensating control. It's just not, it's not permitted by the rule. So but something like workforce clearance procedures or termination procedures, while it's unlikely that an entity wouldn't have a termination procedure for its employees, and not just for HIPAA purposes, but for general workforce purposes, it is an addressable standard. That means an entity can review the requirements, and if it can come up with an alternative equivalent compensating control to the termination procedures in the security rule, then it can apply those. So there is some flexibility of approach when we're talking about required versus addressable implementation specifications. But there's also some flexibility even within required implementation specifications. So the rule isn't just giving us flexibility of approach when it comes to these R versus A situations. It's talking about, for example, the required risk analysis. The rule requires entities to perform a risk analysis, but it doesn't tell you any particular framework or standard to use, such as NIST or others. And it allows entities to take into consideration the size and complexity, capability, the cost of a standard, the capability of a business associate, the probability and criticality of risk, and then comply with the standard in a way that is both relevant to the rule and relevant to the particular entity. So I want to address 2 points of confusion when we talk about addressable implementation specifications, because like I said, the rule specifically states there's a flexibility of approach, and that flexibility is within both required and addressable standards. So both addressable and required implementation specifications are things that you must do. The flexibility of approach is how you do the things that you must do. The second point of confusion is sometimes people look at the word addressable and think that it means optional. If you choose not, and that's just not correct. If you choose not to implement one of the addressable implementation specifications, you must document why the addressable standard isn't reasonable and appropriate and why the alternative control is equivalent. And if there isn't any alternative that is reasonable and appropriate, then an entity must document why there isn't an alternative that's reasonable, appropriate, and that the entity is just accepting the risk and why they're making that determination. So this isn't something where we're talking about required versus optional. This is something where we're talking about required versus required. It just depends on how you do it. And the flexibility of approach is something that's not just applicable to the addressable implementation specifications, but as I mentioned with the risk analysis, and we're going to talk about the risk analysis in a little bit more detail as we go through the administrative safeguards portion of the presentation. But there is flexibility even within the required section. So sometimes the language and the terms get people tripped up a little bit, but we're talking about something that's required no matter what, and you have to document even if you choose not to implement it. And something that is flexible, whether it's required or addressable. So as I mentioned, there are 3 main components or types of safeguards that are required by the security rule to protect electronic healthcare information. And those are administrative, technical, and physical. The definitions for these terms aren't the most helpful. Administrative safeguards are administrative actions and policies and procedures that manage the selection, development, implementation, and maintenance of security safeguards. The definition of technical safeguards are technology and policies and procedures to protect electronic PHI and control access to it. And then for physical safeguards, it's physical measures and policies and procedures to protect an entity's electronic information system and facilities. And so here we have the federal government using the word in the definition and also including the term policies and procedures within each definition. So it can be a little bit confusing to see what's the difference between, for example, a technical and a physical safeguard. I think the easiest delineation is between administrative and the other 2 types of safeguards. When you think about administrative safeguards, think about it's largely identified by people doing things. There are some technical or software, hardware things that can be that are involved in some of the administrative safeguards, but largely think about it in terms of people doing things. And then the physical and technical safeguards are more self-defined by in terms of physical safeguards, we're talking about things like the physical facilities and workstations and devices. And technical are things more like software and hardware controls to guard electronic PHI. So what we're going to do is we're going to go through each of these different sections, and we're going to highlight a few of the particular implementation specifications and some of the issues that go along with them. Because of the number and depth of the specifications under each of these 3 sections, we don't have time or the ability to go through all of them today, but I want to at least give you some specific and targeted value in addition to kind of a broad approach to each of these 3 sections. So let's start with administrative safeguards. One of the implementation specifications relates to personnel. The security rule requires entities to designate a security official who is responsible for developing and implementing its security policies and procedures. As you know, probably the common sense approach is if you don't assign someone, if everybody's responsible for compliance, then no one is responsible. So the security rule requires entities to designate a particular person for developing and implementing security policies and procedures. The next section is training. The security rule requires workforce training and management with respect to appropriate authorization and supervision of workforce members who work with EPHI, training for all workforce members regarding security policies and procedures, and appropriate sanctions against workforce members who violate security policies and procedures. A third section is with respect to information access management, and this is ensuring the least access necessary to electronic PHI based on an employee's or a recipient's role or need for electronic PHI. And, you know, even when we're talking about someone who might be considered a super user, someone who would require lots and lots of access, even super users need access management guidelines and controls. And then the fourth section is security management process. Entities must identify and analyze potential risks to electronic protected health information and implement security measures that reduce risks and vulnerabilities to a reasonable and appropriate level. So we're going to take one of the specific implementation specifications that I mentioned earlier, the risk analysis, and talk a little bit in depth about this. Now, if you're interested in even more information than I'm going to provide to you today, our very first webinar in this series was on this topic, so you can obtain that presentation for even a little bit more information about it. But I chose this specific implementation specification because this is one that has been identified as a challenge area. So I identified that the security rule has a flexibility of approach and stated that even though risk analysis is required, the approach to completing the risk analysis is left up to each entity. In fact, the security rule doesn't even define the risk that entities must implement safeguards to protect against. Instead, it requires entities to figure out those risks for themselves and then identify the controls in place to mitigate those risks. So the specific requirement of a risk analysis is to conduct an accurate and thorough assessment of potential risks and vulnerabilities of systems that create, transmit, receive, or maintain EPHI held by an entity. So this is an enterprise-wide evaluation of servers and systems and anything that deals with electronic protected health information. And a risk analysis that is compliant with the security rule must include these components. It must include a specific system description. So this isn't a 30,000-foot overview of the risks, the systems and the risks. This is a detailed description. So for example, if you're talking about laptops or mobile phones, you must get down to that level of specificity. So you have to have a specific system description. You must specifically identify the vulnerabilities and threats to those specific descriptions. So this can't be just a boilerplate, everything has the same vulnerability and threat, because there's going to be different risks to different systems. You also must include the likelihood of a risk or of a vulnerability or threat occurring, the impact on an entity if the threat did occur, and the controls in place to mitigate the threat. As I said, the reason that I chose this particular implementation specification to talk about is that this is an area where a lot of entities appear to not know what they're doing. They don't know what the basic components and framework of a risk analysis should be, and sometimes they're just copying and pasting year-over-year analysis just to look like they have something. So the OCRs typically ask for consecutive years of analysis to see if an entity is just repeating the same information from one year to the next because an entity is not sure how to perform an actual and thorough risk analysis. And so I mentioned those components of a risk analysis because those must be included in order to have the potential to be compliant. A risk analysis report cannot just be a report that says an entity conducted a risk analysis and here are some general findings. It can't be a business continuity plan. It can't be a disaster recovery plan. It has to, line by line, show the items that were evaluated and the process that the entity went through in identifying the threats to those items and what would happen if one of those threats were exercised, how likely it is that a threat would actually be exercised, and what the entity is doing to reduce the risk to those threats. And so the OCR has provided some tools for kind of a self-assessment, and there are standards like the NIST standard that are out there for entities to use, along with third-party professionals to engage in a risk assessment. So in addition to administrative safeguards, there are also technical safeguards. And I want to talk about the 4 different kind of areas: access, audit, integrity, and transmission, and spend a little bit of time talking about those first 2 in some detail: the access controls standards and the audit control standards. So the access controls is a standard that has some 4 different implementation specifications underneath it. The access control standards say that an entity must implement technical policies to only permit authorized individuals to access electronic protected health information. And that, like I said, there are 4 different implementation specifications under access control, including required and addressable implementation specifications. The first one is an automatic log-off. And this is something that I know practitioners love, automatic system log-off. And it's the requirement is to implement an electronic procedure that terminates an electronic session after a predetermined time of inactivity. So this can apply to a laptop or some kind of tablet. And this is an addressable implementation specification. So the rule allows for an alternative access control besides just an automatic log-off. But alternatives can be difficult, even more difficult than just an automatic log-off. So one option is to hire someone to guard a workstation or a tablet while a practitioner leaves that to treat a patient or to do something else and make sure that nobody views or accesses PHI on that workstation. But that's cost prohibitive, and it also, it must be noted that this automatic log-off requirement applies to remote access sessions. So if someone is working from home or working from the road and they're on a laptop, the automatic log-off is an addressable implementation specification for those as well. So it would require an entity, if they wanted to hire someone to guard a workstation or a laptop, they'd have to hire someone for someone to watch every workstation or device that is used remotely. And so this is one that's really frustrating to practitioners. Often they're in the middle of practice or treating or seeing a patient, and they log on, they're looking at information, they go to talk to a patient or someone else, and then the log off occurs, and they go back to the computer to record information or to review information, and they have to log back in, and it can be very frustrating. So I want to pass on a story I heard about the way that these safeguards are designed to protect information, but the way that practitioners sometimes use them puts them in jeopardy. So an entity decided that they were going to try to develop an alternative access control besides log-off, because practitioners in I believe it was a hospital, were so frustrated with the log-off process that they decided that something had to be done. And so what they did was they created kind of a pressure point system to where if there was something weighted by the workstation or the device, then it would be logged on. But after a certain predetermined amount of time, after that weight or that pressure was lifted or removed, then the workstation would log off. So if you had your arm or your hand resting on something, and then the computer was usable. And so the practitioners were excited about this development. They wouldn't have to keep logging in and out. And then, but what happened is the practitioners figured out that if they took their coffee cups with coffee in them and put them on the pressure point, then the computer would just stay logged in, even if they had to walk away for a longer period of time. And so, what was potentially creative alternative access control turned into something that was exposing this this covered entity to even more risk and challenge than the original automatic log-off. And so there's 2 points to this. One is with respect to automatic log-offs, there are alternatives out there, but they can be even more difficult to implement than the automatic log-off. And the second takeaway is that when we're designing and implementing safeguards, and not just the automatic log-off and not just technical safeguards, but all of the safeguards and implementation specifications, one important piece of the process is to get input from the end users, from the device users, from HR or trainers in terms of workforce training, physical facility supervisors, whoever it is, depending on the different control. It's important to get input from those users and to observe how those users interact with the controls to ensure that the controls are both useful, but also ensure that the users aren't able to expose a kind of a deficiency in a control like the coffee cup on the pressure point system. So another technical safeguard that's important standard to consider is the audit control. So entities must implement hardware, software, and/or procedural mechanisms that record and examine activity and information systems that contain or use electronic protected health information. So I want to give some kind of guidelines and requirements for this audit control portion that is less of a specific item like the automatic log-off or the pressure point, and more just kind of an overview of things to consider within the audit control standard. So first, this requirement means ensuring that mechanisms to record and examine activity within information systems are in place. And specifically, those mechanisms should generate system audit logs. So you have to have mechanisms that are recording and examining activity in those information systems, and those mechanisms have to be able to provide report on what activity that they are monitoring and examining. The second part of that is to ensure that if those logs are in place, that audit trails are monitored and reviewed as close to real time as possible. As close to real time as possible to be useful. Depending on the risks related to a specific network or piece of software or hardware, the review period might be more or less frequent. But the review must be as frequent enough, as close to real time as possible to be useful. The system tool must provide specific enough information to enable your organization to identify the problem. So while it's a must that there are mechanisms in place that are generating audit logs, if those audit logs aren't specific enough to identify where issues are, they're almost as worthless as not being there in the first place. And moreover, those tools, to the extent possible, should be enhanced and amended over time to eliminate false positives and to close loopholes. So once an audit tool is put into place, to the extent that it's possible to tinker with that tool, going through a period of time, whether it's a quarter or a year of audit logs to evaluate times where the audit tool is identifying things that aren't actually systems issues, and to determine whether the tool is missing things that are systems issues, and the tool either needs to be changed or another tool needs to be added to it. And then there needs to be a reporting process, a documented process for communicating issues discovered by the audit controls. Who has to report it, how soon they have to report it, who they have to report it to, and what those individuals who receive those reports must do with that information. Now, as I said, there's a flexibility of approach within the security rules. So your audit controls can be based on your risk analysis and your risk management, so that each organization determines how intensive an audit control really needs to be based on the organization's services, its size, its sophistication, and other factors. So in addition to the access controls like automatic log-off and encryption and the audit controls, mechanisms to review activity and generate system logs, you also have integrity controls and the technical safeguards. Those are policies and procedures and other things to ensure that electronic PHI is not altered or destroyed, and electronic measures to ensure data integrity. And then transmission security controls. So entities must implement measures to ensure that electronic PHI being transmitted is not subject to unauthorized access. The third section of the security rule, the third section of safeguards that we have to consider is the physical safeguards. And we can kind of break that down into access, workstations, and devices. So in terms of facility access control, there are 4 different standards. There are contingency operations, facility security plans, access control and validation, and maintenance records. And those are all 4 addressable standards. And then you also have a couple of different standards related to workstations, both workstation use and workstation security. And I want to spend part of our time on the physical safeguards talking about workstation security. And some of these recommendations come from SANS, the Information and Cybersecurity Organization. So here are a list of items that should be in a workstation security policy and procedure based on industry best practices. Workstation security is enhanced by making sure that individuals are complying with all of an organization's password policies, by ensuring that workstations are used for authorized business purposes only, by ensuring that unauthorized software is never installed on workstations, storing all electronic protected health information on network servers, securing laptops by using cable locks or locking laptops up in drawers or cabinets, maintaining baseline configuration standards. So the way that a workstation, a laptop, or a desktop, or a tablet, or a phone is originally configured according to an organization's standards to make sure that the device or workstation maintains that baseline configuration. For workstations, installing privacy screen filters or other physical barriers to limit data exposure. Ensuring that workstations are left on but logged off in order to facilitate after-hours updates. So this one may seem a little bit counterintuitive that, if you have a workstation that you're not taking, if it's not a laptop that you're taking with you, or if it's a laptop that you're leaving, that you would not only log off, but that you would turn it off for security purposes. But in terms of patches and updates that occur after hours, security, workstation security is it's critical to rely on patches to mitigate vulnerabilities. So making sure that workstations that are left at a facility are on but are locked off. On the flip side, exit running applications and closed open documents when you leave a workstation, and ensuring that all workstations use a surge protector, not just a power strip or a battery backup. So that's a list of items that would be recommended for your workstation security policy and procedure. In terms of devices, I want to talk about 2 specific elements. These are both required implementation specifications under the device standard, and that's with respect to disposal and device reuse. So the disposal requirement says that an entity must implement policies and procedures to address the final disposition of electronic protected health information and or the hardware or electronic media on which that protected health information is stored. And then, so I want to talk about some guidance that apply to both device disposal and device reuse. So with respect to both of them, reuse and disposal, the first step is to determine compliance with record retention schedules. So to ensure that the electronic PHI on media that is being considered for destruction or reuse is not within the record retention schedule in a way that would make destruction or reuse of that device violate a record retention schedule. If the information is not within the retention schedule period, the second step is to determine whether the information on the device is subject to litigation, open litigation, open audit, or open investigation. So before reusing or setting for disposal or disposing of a device, it must be determined whether or not there's litigation involving any of the information on that device or an audit or an investigation. So if it's been determined that there aren't any issues with record retention schedule and there aren't any issues with EPHI related to litigation or audits or investigations on that device, for reuse, the two options are basically to overwrite the data using software or to degauss the data, which means to take a magnetic field to wipe the data. Those are pretty much the standards for transitioning a device to for reuse. For destruction, that's obviously a lot more in-depth. One of the steps after you've determined that the information on the device is not subject to investigation or record retention schedule or audit or litigation, that device must be secured until destruction occurs. And whatever way that it's physical security, whatever mechanisms there are to make sure the device isn't left unsecured since it's not going to be used anymore, you still have to secure the device. And then you have to document the following: the date of the destruction or disposal, the method of destruction or disposal, the description of the devices that were destroyed or disposed of, the dates that are covered within the information. So if it was a thumb drive or a tablet or a external hard drive that had EPHI from 2001 to 2002, that needs to be documented. A statement that the patient information records were destroyed or disposed of in the normal course of business. So this is just kind of an attestation that this wasn't to destroy data prior to discovery or an investigation. And then finally, the signatures of the individuals who are supervising and witnessing the destruction or the disposal to ensure that there is a trail of accountability to determine whether that destruction actually occurred and if it occurred in the mechanism that the document describes, and if it includes the type of information that the record stated does. Now, there's even more consideration if you're contracting another company to destroy or dispose of devices that contain electronic protected health information. So if you're contracting that out, then you have to have a BA agreement in place that specifies the method of destruction for different types of devices. Now, usually the type of destruction or the method of destruction depends on the type of device that we're talking about. So it could be a magnetic wipe, it could be pulverizing, overwriting, reformatting, shredding, and as I said, those different options are best used for different types of devices. So the BA agreement with a records management destruction company needs to include how they're going to destroy the types of devices that are provided to them. The BA agreement also needs to specify that there's going to be proof of destruction. So usually this is some kind of certificate of destruction that's provided with a date on it and maybe a little bit more information on there. Also recommend an indemnification clause that says anything that the destruction records or device destruction organization does that violates the BA agreement or law, that this third-party destruction company is going to indemnify or hold harmless this BA or covered entity that's providing it devices for destruction. The business associate agreement also needs to include controls that the destruction company has in place to prevent impermissible disclosures, just like any other BA would. And the BA agreement should also include the time periods between the standard, the SLA for the time periods between when the destruction company receives a device and the time that it actually destroys the device, so that you can have a reasonable assurance that there isn't an overly long period where a destruction company has a device and it's maintaining it instead of destroying it, and it might be that device might be subject to risks. So when we're talking about physical safeguards, we've got access, we've got workstations, and we have devices. I hope the details that we talked about with workstation security, items for policies and procedures, and some of the practices for device reuse and destruction were useful for you. So that brings us to kind of the conclusion of my part of the presentation today before we open it up for questions. And I just want to kind of give you 3 different things to wrap up our discussion today. That is scope, flexibility, and safeguards. So when we're considering the security rule summary, the scope of our activities are electronic PHI. And that may seem like it doesn't really narrow the scope at all, but it should help us to tailor. It's not so much just narrowing our scope as it is tailoring it to the specific issues and vulnerabilities and costs and approaches related to ensuring the confidentiality, integrity, and availability of ePHI. So when we're talking about security rule requirements, we're talking about ePHI. The second is a flexibility of approach. That's not just something that I use to describe the security rule. That's actual language, actual text within the rule. And that flexibility of approach relates to both an entity-specific consideration, so a small practitioner versus a multi-facility, multi-thousand employee medical group versus a clearinghouse versus a medical billing company. Now, there's a flexibility of approach. All the requirements are the same, but the way that an entity complies with those requirements is different depending on those entity-specific considerations. And then there's also a sense of flexibility in terms of required standards versus required implementation specifications versus addressable implementation specifications. And then the third item is the safeguards. There are those things that are required, and then there are those items that are addressable. And as an entity reviews all of those specific things within the rule and within the appendix, it's important to consider what is reasonable for an organization to comply, because compliance is not optional. But there, like I said, there is some flexibility in implementing these administrative, physical, and technical safeguards as required by the rule. So I appreciate your attendance at today's session, and we have some time, so we can open it up to questions.
It does not look like we have any questions that have come through yet, but I'll give everyone a couple of minutes to ask any questions while I go over a few things here at the end. As Mark mentioned earlier, we do have a schedule planned out for the remainder of the year on HIPAA-related topics. So take a look at that schedule, and you'll be receiving invitations for future emails if you're on this webinar. So be on the lookout for those. Our next topic is going to be managing business associate compliance, and that will be sometime next month.
So one of the questions that, while we see if anybody has one who's attending, one of the questions that sometimes is asked is about how to approach addressable implementation specifications. So an entity sees that those are addressable, and once they understand that those aren't optional, they spend some time trying to figure out if the standard is too difficult for them as an entity to implement. And so they say, how do we decide whether or not an alternative is compliant? And the discussions can go on, and it can cause a lot of challenges for an entity. So one approach to this addressable versus required discussion is just to say, for a compliance and confidence within the marketplace perspective, some entities just say, we're going to implement and all addressable standards, all addressable implementation specifications as if they're required. We're going to look at the security rule and say, if it's in there, it's required, there aren't any real alternatives, and that way we'll ensure that we're at least setting ourselves up for a standard of compliance, rather than trying to come up with an alternative that may not even come close to meeting the standard. So one question is, well, how do we address these? How do we respond to these addressable implementation specifications? And one way is just to say, just treat them as if they're required and implement accordingly.
All right. Let's see. If a small organization contracts all IT services, what expectations should be addressed in the business associate agreement?
So that's a good question. So I talked a little bit about business associate agreements with like a destruction company, and I gave some tips there. But a BA agreement with information security company should be specific to the type of service that that information security, that IT company provides. So that would relate to, depending on what kind of services those are, there are some similarities to the BA agreement for destruction company, and that would be what kind of controls does an IT company have in place to prevent impermissible disclosure, background checks on the individuals who will be accessing and working on an entity's information systems, methods in place to check access. So if an IT company is supposed to be accessing information at a certain time, making sure that there's no out of curfew access. There should be some change control considerations in place to ensure that the IT company isn't making changes to an entity's network and systems and security controls without thorough review and approval. There should be reporting requirements. So what happens if the IT company has a breach or an incident? What kind of response should that information security company or information technology company provide to the BA or to the covered entity?
Great, thank you. It looks like that's the only question that has come through. So there's Mark's contact information up there on the screen, and if you have any other questions, feel free to reach out to him, and he will address those for you. I just want to thank everyone again for joining our session today, and we hope to see you next time. Thank you, Mark.
Thank you.